Good afternoon, and welcome to this community briefing on our ongoing pandemic response efforts. Providing interpretation for us today is Margie Prupp. Thank you, Margie. And thanks to everyone for joining us to learn about the latest local developments. The Delta variant continues to circulate in our community, but week by week we're making progress. Our local conditions are steadily improving. COVID-19 cases have dropped each of the last 4 weeks, and this includes cases in school-age children across Lancaster County. The percentage of our population 16 and older who are fully vaccinated continues to climb, and I'm happy to say stands at 74% today. However, our positivity rate remains high at just under 10% for the third straight week. And our hospitals providing care to our relatives, friends, and neighbors are still very stressed. It's clear our efforts are making a positive impact, but we are not there yet, and we need to continue to work together to keep our numbers moving in the right direction. The chart you're looking at now shows the slow decline in cases this month. The 7-day rolling average of new daily cases dropped from 135 at the beginning of the month down to about 80 on September 30th, a drop of about 40%. This is a good downward trend. However, 80 cases per day is still too high. We want case numbers to keep coming down. We've also seen a drop in the number of Lancaster County residents hospitalized with COVID from a daily average of 70 on September 1st to 50 by the end of the month of September. But we've seen the opposite with hospitalizations from other communities. This month, the daily average of COVID patients hospitalized locally increased from 28 on September 1st to 53 by the end of the month. Because of this shift, the total 7-day rolling average of hospitalizations has stayed steady for the past month. We started in an average of 98 on September 1st and ended at 103 on the 30th. Today, there are 107 COVID-19 patients hospitalized, with 50 of those from Lancaster County. Overall, the high number of patients hospitalized with COVID-19 continues to stress our hospitals, and the number of staff beds remains limited. Joining us today is Russ Gronwald, President and CEO of Bryan Health, to provide an update about the current situation from the hospital perspective. Russ?
Thank you, Director Lopez, for your ongoing partnership. We're encouraged by some of the local trends. We haven't seen all of those across Nebraska, but we are encouraged by some of the things that we're seeing locally in terms of the case rates going down. As Director Lopez says, hospitalizations haven't gone down here locally at this time. Today, Bryan is running 89 COVID patients as of this morning, 74 that were confirmed, and 15 that were pending at that time that I presume will have been confirmed by now. About 80% of those were unvaccinated. In the ICU, 92% were unvaccinated, so this continues to be the most devastating effects on the unvaccinated. I thought I would talk just a moment about the issue of Lancaster County patients versus greater Nebraska patients and how that works at Bryan, some of which you know, but maybe a little bit more detail on that today. Typically, without COVID, we run between 500 and 540 inpatients at Bryan with a top capacity of roughly 540. 2/3 of those on any given day, again without COVID, come from Lancaster County, and 1/3 come from greater Nebraska. And that combined number, that combined patient base, really provides a large enough base to sustain high quality, complex care to a level that would otherwise be much more difficult if we were only looking at Lincoln and Lancaster County population. So that means that we have a number of specialties available to us in a strong enough cohort that we can have services like neurology, endocrinology, infectious disease, which is really important right now, maternal fetal medicine. Even the cancer care center that we have recently announced has been designed in a way that's going to give us more services because we are attracting a larger patient base. So we believe this approach of this combining of Lancaster County with much of greater Nebraska really serves the larger region well and also allows us to keep up with the growth of a modern city like Lincoln. Today at Bryan, because of COVID, we are greater than 540, as we have been most of the last month and regularly throughout the last 20 months. As I said, typically we run between 500 and 540 without COVID. In a given day, we would have maybe 100 plus cardiology patients, 60 to 70 behavioral patients, over 100 patients in the Women's and Children's Tower. Last night, for example, we cared for several Category 1 traumas. That's just typical. And so the question is, why do I mention that? Well, two reasons. It's not just that greater Nebraska has 15 to 20 more COVID patients coming our way than does Lancaster County right now. It's that we have 89 COVID patients in total coming our way. That's what's continuing to cause us to exceed our physical capacity and put that incredible pressure on our staff. The second thing, though, I wanted to mention is that I do want to say thank you to Lincoln, Lancaster County. Your vaccine and mask compliance over these last months has caused COVID cases within the county to come down just as greater Nebraska cases were going up. And that has allowed places like Bryan and CHI and others to get by sort of living on the edge, if you will, but still being able to care for those critical care needs as they happen. It's just that we're going to have to continue that momentum and those trends. I know that the last 20 months has been hard on you and increasingly taxing for our staff, but you've continued to support us in so many ways, and we're very, very grateful for that. And I'm just going to say it again, the number one thing you can continue to do is to support vaccination wherever you find it. As additional cohorts, vaccines become available to them, we need you to be out there spreading the word. One way to do that is to use sometimes these pictorials that you've seen what Director Lopez gives, that you've seen Bryan and others give, that talk about vaccinated versus unvaccinated folks. We actually have a new page on our website. If you go to bryanhealth.com and our COVID website, you're going to see something that's updated daily. It's going to give you all of this information about where are patients coming from, the number that are vaccinated versus unvaccinated, age groups, and so forth. And you'll be able to keep up and see how this is all playing out. So I would encourage you to do that and then use some of those pictorials to educate others. I've found that often it's not our rhetoric that's most effective, but those pictorial graphs have been some of the most effective things that we've done. So thank you for your partnership and continue to help us as we try to get ourselves to the finish line here.
Thank you, Russ. We really appreciate the work of our local hospitals and the care they're providing to patients. Throughout this pandemic, we have all worked very closely together, which sometimes people in other communities are surprised to hear that a community the size of Lincoln has such close relationships, not only with our health systems, but with our healthcare providers. While hospitalizations stayed steady over the last month, deaths declined in September, mirroring the decline in cases. We had 27 deaths from COVID in August and 19 in September. 9 of those individuals who died in September were under the age of 60. 4 were in their 50s, 2 were in their 40s, and 2 were in their 30s, and 1 was in their 20s. We feel great sorrow for those family members who lost their loved ones. I think it's really important to know that all 9 deaths under the age of 60 were unvaccinated. Since March of this year, we've reported 67 deaths due to COVID-19. The increase in deaths followed the surge in cases caused by the Delta variant that began in July. The chart you're looking at now shows the number of deaths from each month with the number of unvaccinated in blue. Of the 67 people who died, 54 or 81% were unvaccinated. We are also sadly reporting 1 death today. A woman in her 60s who also was unvaccinated. This is the first death we are reporting in October. Our condolences to our family and loved ones. In addition to case numbers, we also are seeing improvement in the turnaround time for lab reporting and contact tracing. Our positivity rate has improved slightly, but is still at an elevated level. And two metrics remain in the orange category: hospitalizations and COVID-19 deaths. When reviewing all of the metrics together, the risk dial has moved closer to the yellow category, but it remains in the low orange range this week. The current position of the dial is indicated by the blue square outlined in red, which can be seen on this chart just on the border of the orange and yellow. The orange category indicates that the risk of the virus spreading and the impact on our community continues to be high. As our earlier charts show, those who are experiencing some of the most severe outcomes during this Delta-driven surge are those who are unvaccinated. Ensuring people who are unvaccinated have ongoing opportunities to receive vaccine remains a top priority for us. And we will keep working with partners to host clinics that are accessible, convenient, and close to home. We're fortunate to have safe and effective vaccines that offer strong protection against severe illness, hospitalizations, and death, and urge everyone who is eligible to get vaccinated. 74% of Lancaster County residents aged 16 and older are now fully vaccinated. We are only about 2,500 people away from reaching our initial goal of 75%. When we look at the vaccination data for all 319,000 Lancaster County residents, almost 60% are fully vaccinated. Some of those who are still unvaccinated are not yet eligible, like children under 12. But there are still many in our community, around 66,000 people, who are eligible for COVID-19 vaccine but have not yet received it. The chart you're seeing now shows the percentage of those fully vaccinated by age group. All age groups above age 45 have reached and exceeded the 75% fully vaccinated mark. The percentages for the age groups 12 to 44 are rising, but there's still opportunity to increase vaccination rates in these age groups. Certain groups of people can now maximize their existing protection against COVID-19 and its variants through a booster dose of vaccine. The Centers for Disease Control and Prevention approved Pfizer booster doses on September 24th for people 65 and older and residents in long-term care facilities. People ages 18 to 64 with underlying medical conditions that put them at high risk of severe outcomes for COVID-19, and people who work for or live in a setting where they have increased exposure to COVID-19. We immediately put our plans into action so we could start booster dose clinics. We're using an approach similar to the initial rollout of COVID-19 vaccine, moving through age and priority groups and stages. We held 3 booster dose clinics last week in partnership with CHI St. Elizabeth, and this video is from our first clinic last Wednesday. We started offering boosters to older adults and vaccinated more than 3,000 people at those 3 clinics last week. Right now, the booster dose recommendation only applies to people who've received 2 doses of Pfizer vaccine, and the booster is given at least 6 months after the second dose. The health department is providing booster doses through designated clinics. This week, we're holding 2 booster dose clinics at Pinnacle Bank Arena for people 65 years and older and first responders. Those clinics are tomorrow and Friday. The health department is contacting people in these age groups to schedule appointments. We are also working with community partners to provide booster doses in addition to first and second doses at some of the upcoming neighborhood clinics. Booster doses for people aged 65 and older will also be offered at Sunday's clinic at Crystal Ray Church and at a clinic next Wednesday, October 13 at Mount Zion Baptist Church. Again, the booster doses are only for those who have received Pfizer vaccine Potential booster dose recommendations for Moderna and Johnson & Johnson vaccines are still being determined. We are monitoring new developments closely and will provide more information as soon as it's available. Also, several local pharmacies are also providing Pfizer booster doses. You can find a pharmacy near you at vaccines.gov or by texting your zip code to 438-829. Getting vaccinated and wearing a mask are proven public health strategies that help protect our community and get us through this. It's clear that these and other preventative efforts are making a positive impact. Week by week, our data is showing progress, but we're not there yet. We want to see fewer new cases, fewer people in the hospital, and a lower positivity rate. We all play a role in this response, and our collective action helps drive our community's progress. Please get vaccinated if you haven't already and wear a mask. And with that, we'll take any questions. Okay. No questions? All right.
Director Lopez, this is Bill with 1011. It looks like that 16 to 24 age group vaccination rate really hasn't changed a whole lot in the last month or so. What kind of efforts are being made to reach that group?
You know, we're still reaching out, and actually, Bill, we'll be going into the schools, several in coordinated effort every Tuesday for the next 4 weeks or 5 weeks. So we'll be doing on-site vaccinations, not only just for COVID, but other immunizations as well. So we continue to work with the schools, and what you're seeing is that some of those individuals are needing their third dose. So probably in the next 2 weeks, you're going to see an increase in that age group. Okay, any other questions? All right. On a final note, we're moving into flu season, and we encourage people to get their flu vaccine. The flu vaccine is recommended for everyone 6 months and older and is widely available in our community. And it provides that protection against flu, which can make any of us sick and can be a life-threatening illness for some people. Getting flu vaccine also helps preserve our hospital capacity during this pandemic. I think it's important to mention that there is no waiting period between receiving a COVID-19 vaccine and other vaccination. So you can receive your flu vaccine and your COVID vaccine at the same time. Thanks again for joining us today.